Post-traumatic stress disorder symptoms may start within 3 months of a traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms cause significant problems in social or work situations and in relationships.
People vary so much in the way they respond to these incidents. First of all, during the incident itself, people's behavior varies hugely. Some people go through the whole thing on adrenaline and hardly realize what's happening to them. They just perform, often brilliantly. They just do the thing. They perhaps don't even realize what's happening to them. They just know what to do and they do it. At the other extreme, you've got people who are completely overwhelmed by what's happening and don't perform at all well. And these are all normal, these responses.
Post-traumatic stress disorder symptoms can vary in intensity over time. One may have more post-traumatic stress disorder symptoms when they are stressed in general or when running into reminders of what they went through. When then should post-traumatic counseling sessions start?
Immediate counseling of people who are involved in these things is actually counterproductive. It actually causes symptoms. And so the right thing to do to people who are in the thick of it is to give them lots of information and get them back to their families as quickly as possible and encourage the families to support them. And then wait a week or two to see which of them are going to be affected. But to sort of encourage people to rush into a tent as they come out and talk to a counsellor, especially if the counsellor is not very skilled. It's a very bad thing to do.
Symptoms of post-traumatic stress may include trying to avoid thinking or talking about the traumatic event, avoiding places, activities or people that remind a person of the traumatic event, hopelessness about the future, inability to experience positive emotions, feeling emotionally numb, being easily startled or frightened, irritability, angry outbursts or aggressive behavior, overwhelming guilt or shame, always being on guard for danger, self-destructive behavior such as drinking too much or driving too fast, recurrent unwanted distressing memories of the traumatic event, upsetting dreams about the traumatic event, and difficulty maintaining close relationships.
People who've been involved in a thing like this, they and their families should watch for symptoms like this. They should just be aware that this can happen. And if somebody starts to behave differently, then people should pay attention to that. They shouldn't just assume that because a year's gone by that actually everything's okay.
The most common events leading to the development of post-traumatic stress disorder include combat exposure, childhood neglect and physical abuse, sexual assault, physical attack, being threatened with a weapon, natural disaster, kidnapping, fire, life-threatening medical diagnosis, and terrorist attack. Well then, is there treatment and hope to a complete recovery?
One of the reasons why post-traumatic stress can be tricky is that if somebody goes along to somebody who's not particularly familiar with it and just says, I'm feeling depressed, the chances are they'll be given pills for depression. Not the right response. The person interviewing them needs to know that there was an incident. So they have to ask the right questions. Because how you treat somebody who's down and depressed and what have you as part of post-traumatic stress is very different to how you would where somebody's genuinely clinically depressed. It's only in very rare and very serious cases that there are long-term problems. For most people, just simply talking to a professional who understands what's going on in their mind, within hours they will start to feel very much better.
Having post-traumatic stress disorder may also increase a person's risk of other mental health problems such as depression and anxiety, issues with drugs or alcohol use, eating disorders, and suicidal thoughts.